Good day, my dear postgraduate students. Hope you are all doing well for the new year 2023. And the class for today shall be from the recent advances 25. The topic is the pathological manifestations of the vaccination, COVID-19 vaccine, and what is the contribution of an autopsy towards it. What I thought would have been a very simple topic took me through the nuances of pathology, radiology, and clinical medicine. In fact, it is an intricate topic, rather difficult for us to understand. But then we are reaping the benefits of the vaccine. So much so that today is a good news day, but there are challenges ahead. And see the reference of this particular statement, Professor of Pharmacoepidemiology. So it is not pathology or microbiology. There are other disciplines that have contributed their huge might to this disease. And as usual, think of the subheadings. The subheadings will take you to the answer. And please do remember, the subheadings are not stereotyped for each and every topic. The moment you people are able to recollect the keywords in the subheadings, you are definitely going to write an excellent answer. So kindly go through this patiently. Now, regarding the introduction of the topic itself, there has been a lot of public awareness amidst or about COVID. And this has put an immense amount of pressure on the medical and the pharmaceutical as well as economical disciplines all over the world. Furthermore, there have been instances of death following vaccination. And owing to the lack of morbid anatomy and also the difficulties in performing an autopsy, very few pathologists have got a bird's eye view of the entire happening within the corpse. The disease is rather uncommon, or the manifestations are uncommon within the infants and the teenagers. There have been millions of deaths, and this, the author says sarcastically, is a kind of a relief for pathologists because being a highly spreading disease, it is not possible for the autopsies to be done. So much so, there have been very delicate methods of disposing the cadavers. And these have been studied by the state officials and the clinicians, along with the radiologists whose records give us much light. And regarding the vaccine fatality, it has thrown a public debate into action. All of you will definitely recall that the second dose of vaccine, it took away some important lives and it created a sense of furor and horror in the minds of the public. Three topics have been taken into account as far as the vaccine is concerned. One, an overview of the vaccine-related deaths up to the COVID-19 pandemic, which means before this, what has happened? Secondly, what are all the severe and several clinico-pathological complications, including VITT? And What is the response of the Department of Pathology for the morbid study? Three totally different things which have been covered in this article. And to this, you find that the National Medicine's regulatory publications, the personal experience related to vaccine death have all contributed a lot of detail. The author has taken care that the manufacturer of a vaccine is not mentioned. So also have I. The detailed statistics are also not presented. This can be an advantage or a disadvantage. The therapy is given. There have been a lot of antibiotics and other things that have been given, and the people were standing in a queue, but these have not been discussed. And the review is relatively qualitative rather than quantitative. This was the dose of the vaccine, so many people have received it, and this is the percentage of mortality. That is not the way of presenting it. He simply wants to show us the sense of direction. So this is one of the references that I had managed to pick up. So it is a case of vaccine-induced immune thrombotic thrombocytopenia, VITT, one of the complications. As I go through the entire class, you people will be knowing that there are a few complications which you shall and will remember, of which VITT is one, and these are the references. So I find that there is a clot probably in the subarachnoid space, and following which there is an area of an infarct also. And these have been very well picked up by the MRI. So I would like you people to kindly go through such articles before you come to a final conclusion as such. Also, please do remember that it is not the COVID-19 vaccine alone that has caused death. There have been pandemics and there have been death due to vaccines. Now, what are they? All vaccines will have adverse reactions during death or before death. And the national program interfered because of the individual death. In general, a fear of vaccine has developed among the public. And there are several biological forms of vaccine. For example, activated, inactivated, etc. Other vaccines, such as mumps, measles, and rubella, did not report much of a death. And ADEM, acute disseminated encephalomyelitis, has been observed in many a vaccine. And most of the findings in our case are clinical and radiological rather than pathological. So this we should be having in mind. After all, why is this article on vaccines important? It is because of the list that has been provided on the screen. Continuing with the fatal outcome of vaccines. This is not the COVID-19 vaccine, but then the others. I have got a list of vaccines over here, and what is the type of it and what is the outcome of it. For example, yellow fever. There is an attenuated live yellow fever vaccine, smallpox. So it resulted in smallpox itself. It is a live vaccine. Poliomyelitis, attenuated live OPV, oral polio vaccine, has resulted in poliomyelitis. H1N1 vaccine, this has been a horror only a few years back, and that resulted in a Guillain-Barré syndrome. Measles can be resulting in disseminated infection in immunocompromised. My professor used to say, one of the predisposing conditions for tuberculosis can be measles. Measles and tuberculosis go hand in hand. Smallpox and tuberculosis go hand in hand. The BCG vaccine itself can be resulting in disseminated tuberculosis. Any vaccine, for that matter, can induce an acute anaphylaxis or a syncopal attack. And please do remember, it is not the COVID vaccine, but all the other prior vaccines have caused changes, including the various manifestations of the diseases. Some, of course, have been fatal. And as mentioned earlier, we are not going into the brand name and the types of this vaccine, nor am I going into the details of the virus itself. It will be dealt with definitely in another class. In this class, I will be restricting myself to the vaccine-induced changes, the morbidity and mortality. So, what are the types of vaccines? What are the other vaccines that are available? Morbidity, mortality, autopsy changes. These will be our priority in this class. So, there have been some amount of adverse effect of many vaccine, so such as dyspnea, syncopal attack, pallor, etc. I think most of us would have experienced it during our own session of vaccine. So, this is just a list that has been provided by the Center for Disease Control. The types of COVID vaccines. We people shall be mentioning this. It can be a live attenuated vaccine, inactivated vaccine, mRNA vaccine, or adenovirus vector vaccine. So these are the 4 types. I would like you people to kindly memorize. Also, more than the complications, there can be overlapping diseases such as thrombophilia, cardiac inflammation, or carditis, etc. And vaccine-induced deaths are excluded in this case. Sometimes the inactivated vaccine can lead to ADEM, acute disseminated encephalomyelitis. No death has been reported in this particular case, as long as it is inactivated. So far, that is what he says. Now, what are the complications of the COVID-19 vaccine? When we talk about the complications, it can be a pre-morbid complication or it can be a morbidity itself. So in this case, there are rare cardiovascular adverse side effects associated with COVID-19 vaccine. This is a beautiful picture. I would like you people to kindly remember only the bold letters. There can be a myocarditis and a pericarditis. And there can be VITT, vaccine-induced or immune thrombocytopenic thrombotic thrombocytopenia, VITT. Also, there can be disseminated coagulation in unimportant or uncommon areas. These we will be seeing. And this is the reference. I would advise you people to kindly go to such articles for a better flow of knowledge. And in this case, this is one of the sagittal sinus over here, and this a clot has been seen. So also in the subarachnoid space. These are certain sites where a clot is noticed. And see, it is quite difficult for anyone performing a regular autopsy to pick up these, leave alone the infective part of the cadaver itself. COVID vaccines, how do they act? There are different types of vaccines, such as the recombinant vaccine, mRNA, live attenuated, as well as the viral vector vaccines. Now, any of these vaccines, when it is being injected, so this is the viral antigen. It can be activated or inactivated. This leads to the activation of the or the stimulation of the naive T cells, which can be the T cells or the B cells. The T cell activation will lead to a cellular immune response, whereas the plasma cell and then the B cell will be producing the antibodies as such, and that will lead to humoral responses. So there is a cellular response and an humoral response. In any type of immunological reaction, these two. Finally, there is an elimination of the viral infection. This is what we are to have in mind. So this is about the COVID vaccines. For those who have found it difficult, always repeat it in another form. That is my advice. So there are 4 shaded areas over here which we shall follow. One is vaccination and immunization against COVID. Second one, it leads to the stimulation of IgG synthesis and release. So you find that there can be the various things. The heparin can be combining with the platelet factor 4. And all of this will be leading to some amount of clotting over here. There can be the microparticles and the thrombosis. The binding of the heparin to the FC receptor, it precipitates it. And there can be aggregation of the microthrombi and it can occlude many a blood vessel. These are the complications of the COVID vaccine which you should be having in mind. Always they say thrombosis and thrombosis. What it is, you people will have to explain. Also, whenever there is any disseminated intravascular coagulation or a consumption coagulopathy whatsoever, you find that there is a decrease in the clotting factors, as a result of which there is a widespread bleeding, which can be in various forms such as a COVID vaccine purpura. That is what you are able to see. So purpura are minute dots of a specific diameter. I would like you people to go back and see what is a petechia, what is a purpura, what is an ecchymosis. Definitely in autopsy you will be asked. Myocarditis. So in the heart, it is not going to be a valvular disease or it is not going to be a vegetation or so on. You find that just like a streptococcus, there is a cross reaction of the antibodies to the SARS-CoV-2 spike of glycoproteins. And this will be in the cardiac muscle also. So you find that there is a myocardial contractile proteins which are being damaged or inflamed, leading to a myocarditis. So we have seen VITT as one. The second one is myocarditis. Probably the next few slides will be showing us something about myocarditis. So in this case, there is a viral myocarditis. And whenever I say a viral myocarditis, we should be having this in mind. One, it can be the pre-morbidity or it can be after. Secondly, it need not be specific. In this case, there is a blood clot in the heart that are common in patients with COVID-19 vaccine. And we have found that many a celebrity has passed away after the vaccination. Also, in any of the viral myocarditis, in this case, I am finding a lot of these lymphocytes and probably some plasma cells that are going in between the muscle fibers, creating an edema. These are some manifestations which you should be having in mind. Generally, it can happen even in a hepatitis vaccine or a viral infection, you can be having these changes. But a clot definitely is notorious for COVID-19 vaccine. So you people should write the myocarditis may be post-vaccine or it can be pre-vaccine, part of a disease itself. A good number are due to SARS-CoV-2 infection rather than vaccination. In the borderline cases, there is an absence of myocyte necrosis, whereas in a full-blown case, there can be necrosis of the myocyte. Two variants are seen. Fatal fulminant eosinophilia after the RNA vaccine. Cardiac reaction, it can occur with recovery. And the biopsy is confirmed by means of histology. But unfortunately, you find that this is minimal and even the pictures are very scarce in the net. This can be a blessing in disguise because the pathologists are not thrown at it, and owing to the contagious nature of it, it has saved us from many a nightmare. What are the general features of myocarditis that can be observed? Post-vaccination myocarditis is a veritable minefield. So you will not know what it is there. So, and most of the myocarditis are diagnosed by imaging, not by biopsy itself. Few are diagnosed by autopsy. It is a real entity that should be borne in mind. And it is more common in men than in women. Quite uncommon. Usually the autoimmune diseases will be more common in women. And it is more with mRNA vaccine. Less common with vaccine rather than by infection. So it is only the infection that is causing a myocarditis, as in the slide I had shown earlier. It is not the vaccine induced. And the last one can be seen in histopathology. There is something called as Dallas criteria, which is seen in biopsies. Okay. So there will be a true myocarditis or a necrosis. Infiltration with neutrophils and lymphocytes. interstitial edema, and there can be systemic inflammatory response syndrome, and there may be multi-system inflammatory response. These things we should be bearing in mind. After all, in a case of glomerulonephritis, it would have been mentioned. The patient can be having a rheumatic heart disease as well as a post-streptococcal glomerulonephritis. So please do remember this will apply to multi-systems. So this is one. I have purposely camouflaged one of the areas, and in this one there has been a change, and it has been pointed out by means of the arrow. So this is what this has been picked up as a color Doppler. And the same thing is shown over here. The myocarditis secondary to vaccine. So this can be seen. So this study is from the Radiological Study of North America, R.A.T.S. Kindly go back to such references and enrich your knowledge. The viral myocarditis, as I had mentioned, I am able to see predominantly neutrophils. There might be some plasma cells and lymphocytes. It is more common after the COVID-19 infection rather than vaccination. I had mentioned it earlier, and this is the source of the reference. Myocarditis. In this case, I am finding a massive inflammation. Sheets and sheets of inflammatory cells that are insinuating the muscle bundles, composed mainly of lymphocytes. And in this case, obviously, I find that only the outline is that there is a bit of a coagulative necrosis later on going in for liquefaction. So there is a necrosis that is given over here thanks to brown band. So this is a little difficult, but then we will see what we can understand. So there is a histological assessment that is seen over here, myocarditis in COVID-19 cases. And these are the victims or the post-autopsy findings. What you are going to see is over here in this case, the T lymphocytes. The small round cells are the lymphocytes and the larger cells are the macrophages. The lymphocytes are more over here, and the brown areas are areas of necrosis. So there is a lymphocytic infiltration and then an area of necrosis that you people are seeing. Whereas in a heart without myocarditis, you find it as more of macrophages and very few lymphocytes are seen, no areas of necrosis, which means it is an immunological reaction that is causing a damage without the infection itself. So it is a COVID infected area, but it is not showing any necrosis. Whereas in this case, there has been an infection as well as an immunological reaction that has been showing. So the brown color is necrosis. This is the myocyte that we are seeing. So this is the endothelial cell that we see over here. The T cells are the small cells. Macrophages are the larger cells. I hope this diagram is of some use in making you people understand the two features. One of the references will be this. Kindly go back to this. I have spent a lot of time, nearly about 2 weeks, in picking up the references, and I have not restricted myself to the recent advanced 25. So the fatal complications can be AEFI, adverse event following immunization. So these have been studied by the Medical Healthcare Products Authority, and yellow cards have been issued to such companies which are faulty. There can be anaphylaxis, there can be a Bell's palsy, there can be a delayed type of hypersensitivity, Guillain-Barré syndrome, thromboembolism, myocarditis, pericarditis. I think definitely you people will be well versed in this list, and some of your near and dear ones would have suffered from such a thing. Hopefully, I hope that they have recovered. But it is a must that you people will have to write this. So what are the pre-morbid complications? What are the post-mortem manifestations? So the vaccination-induced immune thrombotic thrombocytopenia, VITT. There can be fatal thrombosis in unusual sites. Usually when a patient is bedridden, there can be a leg vein thrombus. But then here, you are finding a thrombus in the sagittal vein, or you are finding a thrombus in the portal vein, etc. There is a hesitancy among the public to take a vaccine, mucosal bleeding can be seen. The platelet count is reduced. From after all, you people. So platelet count was one that we have been doing it. Thrombosis is an unusual sight, not the usual leg vein. And dural venous sinus thrombosis. Splanchnic and the hepatic veins can be affected. Renal vein also. What are the diagnostic criteria? So you'll have to see what are all the diagnostic criteria. There has to be definite case definitions. Indicate the fundamental criteria. It should be clinical and image supported. It is supported by advanced tests. And the treatment protocol also must be mentioned in this. And there has been discrimination against these syndromes. VTE is venous thromboembolism, TTS is thrombosis, is thrombocytopenic syndrome, DIC is disseminated intravascular coagulation. VITT may be missed at autopsy, and obviously the imaging is a better way of picking it up. And pathologists, moreover, are not up to date. We are not specialized in doing such things, and our findings will be difficult. Most of them happen to be a combination and then a correlation with clinical and radiological pictures. Look at this one. There is a spleen over here, and there is a large area of thrombosis thanks to Elsevier and Elsevier, and this is the reference over here. And this again is a huge hepatic thrombus that has been there in a severely fatal COVID-19 patient at a post-mortem study. Obviously, hats off to them for having done such a great study. The credit goes to them. That is why I mentioned, I never take the articles as such. I give due credibility. It has been available in the net. I would like you people to kindly go to such articles. And this is another diagrammatic view of the portal vein, a branch of the portal vein that is being occluded by means of the platelets. A thrombus is being formed. And this again is the reference over here. Kindly go back to the portal vein thrombosis. So all this irregular outline indicate that it is an activated platelet. Platelet factor 4 is there, and also factor C, gamma R, and free DNA in the vaccine. So these all have been implicated in the formation of a thrombus. Vasculitis. A small number of cases have shown cutaneous vasculitis. It is somewhat similar to the angioitis that we people talk about, leukocytoclastic vasculitis. It can be due to mRNA or an adenovector vaccination. The blood as well as the GIT will be showing anti-neutrophilic cytoplasmic antibodies. And these are negative in a case of immune vasculitis. Kidney also shows a crescentic glomerulonephritis. Look at this one. This is the skin over here, and then there is a vasculitis. There is a sheet of these neutrophils, which we commonly see. Also, there can be extravasation of RBCs, and there may be thrombi within the blood vessels. These are certain things. And within the liver also, microthrombi can be seen. I think I had shown you an earlier picture of this when I took the class on the liver manifestations. The microthrombi can be over here. Vaccine-induced immune thrombocytopenic, thrombotic thrombocytopenic purpura. What happens is there can be fatal thrombosis. All these things we have mentioned earlier. There might be mucosal bleeding. And this is a palette that is showing a bleeding in a patient who has been suffering from such. So the platelet count is low. D-dimer is another test that used to haunt us. We will be regularly doing it and seeing a high value. Unless it comes down, it doesn't mean the patient is recovering. So low platelets, a high level of D-dimer, low fibrinogen, high levels of platelet factor 4, anion complex. And this has been explained in the article. I would like you to go to it. And what you people will be observing will be increasing in the immunoglobulins, recognize the platelet factor 4. It binds to the adenovirus component. It is prothrombotic, similar to the autoimmune heparin-induced thrombocytopenia. I had explained it in an earlier picture. Kindly go back to it. Myocarditis. And what is the role of pathology, imaging, and clinical assessment? So, you find that taxonomically it is very complicated for the pathologist. And all the cases diagnosed will be having a clinical and a cardiac imaging. Very few have got a myocardial biopsy based on which we can make a definite diagnosis of the changes. But please do remember that vaccine myocarditis is real. Men are affected more than women. It can be hormonal, and it is mostly due to mRNA COVID vaccine. The other syndromes can be mild. For example, there can be a varicella zoster-like reaction, development of herpes zoster after the COVID vaccine, and further studies will be required in the lymphocytes and the immunological indices. It is just a mention that the author has made in one of the paragraphs. So, what are the recommendations for the new syndromes in the vaccine study? All pathologists should publish their autopsy reports. Nobody should keep it a secret because it is something that the world itself is fighting against. The report must be national and a database. For example, some countries are now withholding the details, which might not be good for mankind in the long run. All pathologists must apply a definite criteria laid down by the WHO. The scientific committee should create an international database giving all the details, and reports must be available for public health purposes. Autopsy information also should be available. That is why, the moment somebody is positive, immediately we are supposed to inform. And the government takes the necessary measures. The problems in the final diagnosis can be accuracy, and about 1/4 of the cases were suboptimal, no manifestations at all. And finalizing the cause of thrombophilia, etc., will be difficult. This can be some of the problems in diagnosis, even if we perform the postmortem. To conclude, you find that billions of people have been affected by it, and mostly it happened after the booster dose. Death, of course, is minuscule, it is minute, but then there have been multiple complications because of thrombosis and myocarditis. It is a unique opportunity for all of us to study, and the morbid anatomy is still in evolution. As mentioned by the author, it is a blessing in disguise that millions of people have been affected, as a result of which autopsy was not feasible at all. And I would like you people to kindly go through these references. What are the publications, etc.? What are the additional findings? Other autoimmune diseases. And what is the R.A.T.S syndrome? Acute cardiac, pulmonary arrest, etc. And sometimes inactivated vaccine can lead to cerebral toxoplasmosis. And the key points is, within 3 weeks, try to discriminate between the unlikely, possible, and the likely causes of association with COVID. Likely categories: the histology of the blood vessels in the various organs and viscera must be studied, and correlate with the clotting studies, the platelets, antiplatelet antibodies in the thrombosis. Also, you report any of the adverse effects to the National Health Regulating Authority. So a great work has been done. It has been a sense of immense dedication by the entire world, and this has been mentioned. So you find that the disease has been overcome, at least temporarily. Now it appears to be a rebound of it. But then there has been an economic ruin from which we are still to recover. And that is what is mentioned in the next quote. So the person over here is European Central Bank, the manager of whomsoever. And you find that we are standing on one side of a massive river of uncertainty and hardship. And we are now seeing the other side of the river. So this is it. So on one hand, you find that there is a erasal of the humanity, whereas on the other side, you find that there is an uncertainty of economy. How we are going to overcome all this? There is another story, the implications on the students, which we shall see at a later class. Thank you.